Okay, this video is why do the proles get chumped so bad? Because I've noticed, it's kind of sad as a doctor. You talk to the patients and they're just hopeless. I mean, they don't get it. Doctor doesn't have a lot of time, so you try to save them, but most of the time they're so clueless and ignorant, it's impossible to save them. Typical patient, big fat guy, cancer, heart disease, previous open heart surgery. And I say to him, you might want to change your diet. And he says to me, oh, no, doc, it's genetic. I know it's genetic because my sister and my brother, they both got the same thing. Both had open heart surgery. The guy's cancer, getting his foot amputated. And I'm like, maybe it's because you all eat the same thing. Oh, no, doc, I eat healthy, lots of fish and chicken, olive oil. That's the kind of response I get all the time. Oh, I'm cutting down on meat. I'm cutting down on oil. Or, a lady's got pain, arthritis pain. And I'm, again, telling her, you want to improve blood flow to the joint. Low fat, low sodium vegan. She goes, oh, I don't need to lose weight. I'm fine. I like my curves. I don't want to change my diet. I'm like, well, then your only choice is, pills and surgery. People think, getting a picture, an X-ray, a CAT scan, or an MRI is going to make a difference. You don't cure a disease by taking a picture of it. You cure it by optimizing your diet, optimizing your body weight, improving blood flow to the joints, optimizing immune system function by getting your sleep, getting your exercise, avoiding high-fat foods, avoiding sodium, all of those things. Being religious, having a purpose, all of those things improve your ability to heal anything. Okay, also the proles have sort of been conditioned by the public grade schools, high schools, colleges, and even grad schools to trust authority and to be conformist. For example, people trust the medical system. The medical system has a track record with chronic disease of 0%. They never cure the disease. 0% of curing atherosclerosis, diabetes, hypertension. Why would you want to go to somebody who never, ever cures your disease? Okay? Vegan diet routinely cures those conditions. Not always, but routinely. And if you catch it early, usually almost always. Okay? People don't understand how grossly incompetent the medical system is. If you include all the abortions that they perform, do more people get saved or lost by them, okay? They even have invented a new thing called MAID, M-A-I-D, medical assistance and in dying, okay, where they even perform that on teenagers, okay? How insane is that? And that's going to be a good source of information. Don't get me wrong, there's some real smart doctors, and there's some doctors who do a great job treating acute disease, great job treating end-of-life disease. Kidney failure, put in a transplant, put a person on dialysis, extraordinary stuff, okay? Joint replacements are sometimes good when you come to the end of the line, but, why not fix the joint sooner on your own? Okay, but anyways, this idea of a doctor's, all these internal medicine doctors, they don't know nutrition, epidemiology, toxicology, and all the things that start with the letter S. That would be like a baseball coach who doesn't know pitching and catching, a basketball coach who doesn't know anything about dribbling, passing, or free throws. It's a joke. Don't you get it by now? It's a joke. They're going to school not for medicine, but to sell drugs, okay? Most proles also have respect for what I would call popular opinion. Like my ex-wife is a good example of a prole, okay? Theoretically educated, but not really. Okay, and for example, she would say things to me like, that's not normal, when I would have some little habit, whatever it might be, like rinsing my cup off or something after it came out of the dishwasher. And I would ignore her, or sometimes I would say something like, F normal, okay? Normal people are functional illiterates who eat the sad diet to make themselves fat, sick, and stupid. Why would I want to imitate that, okay? Most people think that the system likes them. I remember when I was a young guy, I sort of expected the system to like me, and I was kind of shocked when I realized that the system didn't like me. And the system doesn't, the odds are the system does not like you. Unless you're some super, super rich person, part of the inside club, it doesn't like you most likely, and it especially hates men, especially more than anyone else. It hates Christian men, okay? Its major long-term goals, if you look at the big design of the overall system, it wants, control of the you-know-what population. It wants to bring back you-know-what, slavery, okay? It's obvious. Anybody who's read and studied knows this, all right? Men are routinely, for example, sold into slavery with divorce. That's done on purpose to defund the noble masculinity of society, to make children grow up without fathers. That's not by accident that no-fault divorce is promoted. It's because it's the goal of the system to have children raised without fathers, to defund men, to weaken the country. There's no such thing as a surviving functional gynocracy. It was a way to get rid of the country. Duh. Okay, the medical system is not designed to cure patients. It's designed to sell drugs, lab tests, imaging tests, surgery, and most of all, to make money. The doctors cannot put you as their priority. They just can't. It's not possible for them to do that. They have to be loyal to the bean counters because the bean counters are the ones who judge them. The bean counters are the ones who decide if they get their salary or not. It's the bean counters in the insurance company. So a doctor's got to see 30 patients a day or he gets fired from his job, for example, in some hospitals and clinics. Then, in order to get paid for all the patients he sees, he has to meet the criteria of the billing code. And the billing code is usually going to be a bunch of steps and paperwork that he has to do in order to get paid, in order to confirm that he's followed the standard of care so he can't get sued. So basically, that takes all of his effort and time. Talking to you, if he does it at all, other than the formal questions of like a questionnaire, standardized interview, he's doing you a favor, okay, based on how the system's designed. And they never give him time to teach you stuff more than a brief moment here and there, because if they empowered you to cure yourself, they wouldn't make money. You know how it goes. If you cure the patient, you lose a customer, okay? So the point of all this, why am I doing this? To tell you, you're on your own. No one's going to save you. You have to learn how to save yourself. And if you don't, you're probably screwed. You'd be like the average pro, fat, sick, and stupid by 55 to 60. Okay, so you learn on your own. You can improve your odds of a happy, healthy life, and you just need to educate yourself. And I can also tell you, I've had lots of times, typical outcome if a medical student follows me around, they learn more in 2 hours than they could learn in 12 years about health, because it's easy to learn nutrition, epidemiology, toxicology, and the things that start with the letter S. You have to simply want to be aware that it's worth learning and learn it. You know, a health coach can learn more in a couple of weeks, in 1 month of watching videos, literally, and actually 1 week of watching videos, than the average doctor learns in 12 years of medical training. I can assure you, they are not trained in nutrition, epidemiology, toxicology, and the things that start with the letter S. You know, getting your sleep, exercising instead of being sedentary, managing stress, having a sense of purpose, spirituality, religion, getting sunshine. They really don't know the details of that, and especially the nutrition and toxicology. Those are the most important things. You could also throw E for EMF. You can add that to epidemiology. Okay. And the other thing is, just look at what they do to children for attention deficit. They give the kids amphetamines. Now, to give amphetamines to a child is insane, okay? Like Thomas Shaz, the great psychiatrist, said, that's not medical therapy, that's poisoning, okay? Anybody who would do that, you look at the long-term complications, they're bad. And then when the kid has a complication, they'll often treat that with a new medicine, okay? They're really bad. And what I'm trying to say is, if they would do that to kids, to innocent children, what would they do to you? Use your brain, okay? So that's why you have to be skeptical and you have to educate yourself. And don't get me wrong, the medical system sometimes can provide very useful services or medicines to you, but you have to use it wisely. You should not randomly go there expecting somebody to help you. And you have to remember, the United States does have a national religion that is enforced by law. That religion is called atheistic Darwinism. If a biology teacher in a high school or a college were to, mention intelligent design and God, creation, they could routinely be fired for that, okay? And you're also going to hear a lot of dishonest people that work in the system saying you don't need religion for science. That is completely untrue. The reason why modern science has become a joke is because God has been pushed out of it. Science came from the Catholic Church, and the reason why you need religion and science is you have to have a moral foundation. Once you throw the moral foundation out the door, you've thrown truth out the door. And once you throw truth out the door, the highest bidder gets whatever they want. Okay? As far as atheistic Darwinism is concerned, there is no God. You do not have a soul. There's no difference between you and an ape except that you talk, okay? You're just a talking ape as far as they're concerned. There is no afterlife. There is no God. Your life has no meaning. You have no rights. They have no obligation to you whatsoever. Their obligation is to make money for their stockholders and the higher-ups in the system who own the whole system, okay? That's it. So why would you volunteer to go into the system like that? I mean, if it's an urgent situation, car crash and you're seriously hurt, they might save your life. They're actually pretty good at that, okay? But to voluntarily go to them for some easy problem to fix on your own, like mild hypertension, just, please. And you can fix that in 5 seconds, low fat, low sodium vegan with no oil. The Bible has 10 commandments and the word of Jesus, Jesus Christus. Love thy neighbor, help each other, forgive each other, give each other the benefit of the doubt. Be nice to even the smallest, weakest person. That which you do unto the least of my brethren, you do unto me. That makes people behave. Like Voltaire said, I want my doctor to believe in God so that he does not rob me, okay? And, what's the difference between a doctor and a lawyer? A lawyer will rob you. A doctor will rob you and kill you. So, it's pretty dangerous to walk into the healthcare system. I try to avoid it as best as possible. But there's rare times when maybe I would need it and I would go seek it out. But that would be rare. Like if I had some refractory infection, I would, go get the antibiotic, okay? If I had an acute emergency, go get that dealt with. They're actually pretty good at treating acute causes because they know the cause and they can reverse the cause. But they pretend they don't know the cause of chronic diseases, even though we do, because we know nutrition, epidemiology, and toxicology. And you got to remember what atheistic Darwinism is all about. That was promoted in England in the 1800s. And the reason for it is because it says whoever is the most powerful can do whatever they want. Survival of the fittest. My father was from Ireland, and they got abused, enslaved by the British. And the British loved to say they were the fittest. Based on Darwinism, they could do whatever they wanted to the Irish. So what I'm trying to tell you is the power in the modern world largely comes from big money, okay? And as far as they're concerned, they've got the money, so they're better than you, they're more powerful than you, and they can do whatever they want to you. And they don't even think the weak deserve anything. Trust me, if you study what they say, what they write, what they do, they don't think the lives of the weak mean anything. Okay? So, and they consider the middle class and the poor to be weak. So don't expect them to design a system to help you. So anyways, I'm sorry for all that gloom and doom, but the reason why I give it to you is so that when you walk into the system, instead of walking in like a typical chump saying, oh wow, what a magnificent building, look at all this fancy technology, isn't this wonderful? No, the question to ask yourself is, are they good at helping with the problem that I have? Will they be likely to help me? And what are they going to tell me? And what should I do with their advice? So anyways, I hope that helps you.